Hi, this is Dr. Sidhbh Gallagher. I'm a board-certified plastic and reconstructive surgeon with a special interest in gender confirmation surgery. So today I'm answering a question I was asked, and often do get asked by patients, and that's about other surgeries and their effects on vaginoplasty. So the most common surgery I get asked, will this cause a problem with my vaginoplasty, is orchiectomy prior to full vaginoplasty bottom surgery. In my opinion, no, this does not interfere. The best way to have an orchiectomy, if it's going to be done prior to a vaginoplasty, is through a little incision in the middle of the scrotum, which most surgeons will do. And in this way, it really doesn't interfere. There was maybe a concern or a myth out there that once the testicles are removed, there may be less tissue to work with. In my opinion, that's not the case. Oftentimes we'll use the scrotum to help deepen the vagina, and that scrotal skin isn't going to go anywhere, and I haven't found this to be a problem. Second question I get is circumcision and vaginoplasty. So of course here in the United States, the vast majority of our patients that we see have been circumcised. It's true that if a patient hasn't been circumcised, we do have more tissue to work with, and indeed we're more likely to be able to reconstruct the vaginal canal from just the penis tissue itself, but we do have that scrotal skin to back us up if we need to create extra depth for the vagina. So again, you can have a penile inversion technique usually without much problems if you've already been circumcised. Hernias. So inguinal hernias are one of the most common hernias folks get. And usually the hernia repair is done through a little incision up in the groin area. Now, technically, this shouldn't really interfere with vaginoplasty, but I have noticed amongst my patients, in patients who've had incisions on both sides, we've seen a little bit more wound healing issues afterwards. This may be because the blood supply was disrupted, and ideally, if a patient can have a laparoscopic hernia repair done prior to the surgery, this may be preferable. But again, just because you've had a hernia repaired, this is not a contraindication or reason that you cannot go forward with your vaginoplasty. The surgery that makes us pay attention or that we worry about is prostate surgery before vaginoplasty. And not just a type of prostate surgery where the surgeon has gone through the urethra, such as a TURP, where if the prostate is too big, the surgeon has cleared it out from the inside. Usually this shouldn't be a problem. But what we do worry about is in patients who have had a history of prostate cancer. And that is because that area where we usually create that new vaginal canal has already been operated on and is oftentimes quite scarred. So in these patients, we treat, again, the patient on an individual basis. It makes a difference if they've had radiation as well. And oftentimes we'll make the decision with the patient if they want to take that higher risk of getting a complication by creation of a vaginal canal. That higher risk is probably going to be an injury to the rectum or to the bladder, or if we're just going to do a zero-depth procedure where we're going to feminize the genitalia but not create that vaginal canal. So again, that's a discussion on a case-by-case basis with the patient and her surgeon. I hope this is helpful.